just a couple of the easy and relatively inexpensive things that I would say the majority of people certainly aren't getting from their primary care, yet they can have an enormous impact on your health span trajectory. One of the things that struck me early on when I first started to look at the data was the fact that so many participants were deficient in one or more of these three nutrients. When I first saw this data, I was amazed. I mean, it just kind of blew my mind. If you don't know where you're at for these three nutrients, I would suggest that you go get a blood test and find out. There is just no reason not to fix this. My name is Matt Kaeberlein, and welcome to the Optispan YouTube channel. Hey everyone, welcome to the Optispan podcast. So I'm really excited that after only a few months of putting this channel out there, we're nearing 5,000 subscribers. So thank you to all of you who have been following our content and giving us feedback. As I'm sure you will have noticed, we've spent a lot of time focused on the science of longevity, sometimes really getting into the weeds of that science. And don't worry, we're going to keep doing that. But our mission at Optispan is really to enable optimal health spans for everyone, or at least provide tools and technologies that will enable as many people as possible to get on a better health span trajectory. And so in keeping with that, we are also going to start focusing on providing content that's a bit more pragmatic in nature, that will really help individuals think about what can they do to enhance their own health going forward. And so today what I want to do is talk about a couple of areas where I think there are really opportunities for a lot of people to improve their own health, what I would consider low-hanging fruit. And so again, I think it's clear that our healthcare system is really largely a reactive disease care system. And what I mean by that is that the majority of the time we approach health through the lens of individual diseases, and we typically don't do anything to help people until they are sick. And then we try to cure their disease, but in reality, what we end up typically doing is just treating the symptoms. And I think like many others at Optispan, we recognize that there is a profound need for a shift in the way that we think about health, a change in our healthcare paradigm towards proactive, preventative, science-based healthcare, keeping people healthy rather than keeping people sick. And that's really our goal, is to enable that shift in medicine from reactive disease care to proactive healthcare. And so you may be wondering, well, what can you do right now? And I think there's a lot actually that most people can do. First and foremost, I think it's important to recognize that it's your responsibility to take control of your own health. And I would suggest that if you've never really thought about your health as an investment of resources, maybe it's worth spending some time thinking about that. I would argue that your health is your greatest asset, and you should invest in it that way. And one way to do that is to really focus on finding a good healthcare provider. That's easier said than done, but in general, I think you want to find a doc who thinks prevention rather than repair shop. I think it's worth interviewing your doctor. In fact, a friend of mine actually just made me kind of see it that way. He said that he was looking for a new doctor, and he said that this was really the first time that he had ever approached it where he was interviewing the doctor rather than just trying to find a primary care doc who was available. So I would think about trying to find a doctor who appropriately balances risk reward and who focuses on prevention rather than reactive disease care. I think lifestyle is a place where probably most of us could have a pretty big impact on our health going forward. At Optispan, we kind of think of this as the 4 pillars of health span: eat, move, sleep, connect. We spend a lot of time trying to identify where people are at and then create a personalized health span optimization plan, of which lifestyle is an important component. And I think educating yourself. I mean, I have been on this journey to improve my own health over the last several years. I've learned a lot. I spent 20 years studying the biology of aging, didn't really walk the walk. I'm still working on it for sure, but I've learned a lot and I think made a lot of progress in my own health span optimization journey. So educating yourself, identifying credible sources of information. Hopefully this channel can serve as a credible source of information. And again, I would encourage you to provide feedback, ask questions, and we'll do our best to get the information out there to people. As part of what we're doing at Optispan to enable this kind of approach to health for as many people as possible is we've created what we think of as a corporate health span program. I don't really like the word corporate wellness or the phrase corporate wellness because I think a lot of people associate that with, a negative connotation or, programs that haven't been particularly effective. So we're really trying to ask the question in the context of corporate environment, what can be done to maximally enable improved health span? And so we are currently operating a corporate health span program within Sabi Corporation called Sabi Life Well. As part of that program, we focus on foundational biomarkers. So these are mostly blood-based biomarkers. They go beyond what you will get in your typical primary care blood-based evaluations. I'll talk a little bit about some of those in a minute. We look at body composition by DEXA. I'll talk a little bit about that as well. There's a medical review and referral for existing conditions. We use continuous glucose monitoring, which we'll be having several upcoming episodes on this channel about. And then we supplement to deficiencies. So again, if you've watched our episodes on supplements, or if you've heard me talk about supplements before, I'm not someone who suggests that you should just take every supplement that's out there in case it might help. But I certainly believe that if we measure a deficiency, we should supplement to try to bring people into the optimal range. And I'll hammer that point in just a minute. And then we try to take all of that information along with a lifestyle assessment and create what we call a personal health span optimization plan. And then we use coaching to coach to the pillars of health span to really try to help people move onto a better health span trajectory. So that's our philosophy underlying our corporate health span program. Certainly we have a much more extensive Trailblazer program as well, but really the foundations of both of those programs are around this idea of science-based, preventative, proactive healthcare, and personal health span optimization. And so as part of this project that we've been working on, building the corporate health span program, one of the things that emerged from that is a recognition that many people, probably the majority of people, have fundamental deficiencies in a few nutrient factors that we can measure and easily fix. And so I would put that in the bucket of extremely low-hanging fruit. And the three that I want to focus on today are vitamin D, vitamin B12, and omega-3. And the reason why I'm focusing on these three is because these are the ones that have jumped out of our data as being probably the most common deficiencies, at least in our cohort of individuals. And I really want to make the point here, with these three nutrients in particular, we have a very easy way to measure them quantitatively. And I really want to focus on this idea that we should measure, intervene based on that measurement, and then measure again and make sure that we're moving things into the optimal range. I think too often I have noticed that some healthcare providers, certainly many influencers who are out there, just go right to the intervene. And it's just like, everybody should take supplement X. I think it's particularly a mistake when we have very good ways to measure these factors, right? And so the three that I mentioned, vitamin D, vitamin B12, and omega-3, we have good tests where we can measure circulating levels of these factors, and then we can use supplements to intervene. And then we can measure again and make sure that we have moved individuals into the optimal range. And so again, I really think this is important. Measure, intervene, measure again. Okay, make sure that the intervention is having the effect that you want it to have whenever possible. So at Optispan, we've created our own guidelines for where we would like to see our participants fall for each of these nutrients. And so these are going to line up pretty well with the guidelines that are out there, but they may be a little bit different. And I certainly recognize that informed people can have different opinions about what the cutoff is for deficiency and what the cutoff is for optimal. But I think we've landed at a pretty good place where we've tried to identify the ranges that seem to be optimal based on the entire body of literature that's out there, including many, many epidemiological studies. And so I'll show you those ranges in just a minute. But one of the things that struck me early on when I first started to look at the data that we were collecting from our corporate healthspan program was the fact that so many participants were deficient in one or more of these three nutrients. In fact, looking at our ranges, about 80% of people are deficient in any one of these three given nutrients, and many people are deficient in all three, or at least suboptimal. And in fact, when I first saw this data, I was amazed. I mean, it just kind of blew my mind. I was looking at vitamin D in particular and seeing that 50% of people fall into the deficient range of vitamin D. And I immediately reached out to one of my colleagues who is a practicing physician, and I said, I can't believe it. I'm looking at this data. Did you realize that 50% of people are deficient in vitamin D? And he said, yeah, I know. And my reaction literally was, what the do you mean you know? You're a doctor. Why aren't you fixing this? But of course, it's not his fault. It's not the doctor's fault per se. It's our entire healthcare system, our reactive disease care system that actually doesn't measure these things. Like most people, I never had vitamin D measured in my primary care experience. I actually had to go get the test myself from a direct-to-consumer company. And I don't know if 80% of people are out there in the Seattle area where we're located, or more broadly speaking across the United States. I don't know if these numbers would hold up exactly, but they're probably pretty close. And so if you think about this from a population health perspective, it is just mind-boggling that such a large fraction of the population is walking around with these deficiencies that are trivially easy to fix, and nobody's doing anything about it. Honestly, it bothers me now talking about it. And I've known this for a while. Every time I think about it, it pisses me off. So this is something we really should fix. And I would, again, suggest this is probably a population health issue, but I'm not sure that it's likely that we're going to fix it at the population level anytime soon. And so it falls to you as an individual. If you don't know where you're at for these three nutrients, I would suggest that you go get a blood test and find out, because it's pretty important. Why is it important? So turns out that for each of these, there's a whole host of bad stuff that is associated with deficiency. So for vitamin D, depression, osteoporosis, so loss of bone density, pretty significant hormone imbalances, immune dysfunction, muscle weakness, cancer risk, multiple sclerosis. It turns out, of course, that vitamin D deficiency is more of a problem at higher latitudes, lower altitudes, and the frequency of multiple sclerosis almost perfectly matches that. Higher latitudes and lower altitudes. So there seems to be at least a very, very strong correlation here. I know some people will be like, well, yeah, but you can't prove causality. You're right, I can't prove causality, although for some of these things like hormones, where we know vitamin D is a precursor, there's causality there. Regardless, I think this argument of causality really reflects the reactive disease care mindset. Even if we can't prove causality, there's a pretty darn good plausible connection to causality. And what's the downside of fixing it? So if your doctor says don't worry about it, I'd say find a new doctor. If you're listening to an influencer who says don't worry about it, I'd say find a new influencer. That is the reactive disease care mindset, trying to keep you sick instead of trying to keep you healthy. So what about B12? It's a pretty similar list: depression, dementia, anxiety, neurological complications, anemia, vision problems, gastrointestinal problems, omega-3, depression, dementia, cardiovascular disease, bone density again, eye problems, inflammation, arthritis, skin conditions. So again, each of these has a sort of overlapping but pretty long list of bad stuff that is strongly associated with being deficient or suboptimal in any one of these. And so if you could fix it, why wouldn't you? And you can. Okay, so here, how do you go about fixing it? Well, again, I think the first thing to do is to figure out where you're at. So measure. It turns out that you should certainly ask your primary care doc if they can add it to your set of blood tests. But you may run into resistance. And if you do, it's really probably only costs about $120 to get these three things measured from a blood test. There are companies out there that you can go to direct to consumer, get the tests ordered. So I know LabCorp will do it, Quest will do it. The company that I've used is called Ulta Labs. They're pretty inexpensive. You can order these blood tests, go to a local Quest service center, get your blood drawn, and then within a few days, find out where you're at on the spectrum. So again, pretty easy. I get that it's $120, but again, your health is your greatest asset. It's probably worth $120 investment to find out whether you're deficient in these things. So, and then how do you interpret that? And again, this is the Optispan guidelines. This doesn't match up exactly necessarily with other guidelines that are out there, but it's pretty close. So I'm not saying you need to use these. I'm just saying this is what we do in our programs. So we would really like to see vitamin D between 60 and 100 nanograms per milliliter. We don't want it to go higher than 100. We'd like to see vitamin B12 in 750 to 1300 picograms per milliliter. We'd really like to see omega index greater than 8, okay? Omega index is DHA plus EPA. So depending on the blood test you get, that may be represented in different ways, but if you add up DHA plus EPA, that will give you your omega index. Again, this is based on our interpretation of the large body of epidemiology that's out there. I think these are pretty good guidelines. So that's what we shoot for. And as I mentioned, in my own experience, the first time I ever had these factors measured in my blood wasn't until late 2022. So I was 51, probably deficient for much of my life. And again, that's very frustrating because I just didn't know. And now I do. And I'm pissed off about it. So the first time that I had my omega index calculated from blood measurements, I was actually not too bad by American standards. I was almost 4, which still puts me in the deficient range by the Optispan guidelines. We really shoot for an omega index 8 or higher. And I've been working on it since then. So I've been supplementing with DHA and EPA supplements, 1135 mg pills is what I've been using. I took 1 pill a day for a while, and that moved me up a little bit, but not a lot. I should say also, I have changed my diet to focus on more foods that are rich in omega-3 fatty acids like seafood. So I certainly don't want to suggest that supplementation alone is the best strategy here. But even at 1135 mg pill a day, my omega index only went up by less than 1 over a year. And so I've increased that to 2. And in fact, sometimes I take 3 pills a day, still trying to get my omega index up. Most recently, it was about 6. So at least it's going in the right direction. This puts me squarely in the middle of the suboptimal range according to our guidelines. Vitamin B12, I actually had a lot of success in moving myself up into the low end of what we consider the optimal range with a 1,000 microgram per day supplementation. And then vitamin D has been a little bit tricky for me. So again, I think this example really points to the need for measure, intervene, measure again. I think it also illustrates that there can be some fluctuation over time, and I don't know whether that's errors in the laboratory measurements or real physiological variation. But this was an interesting case example of trying to dial it in and actually shooting too high. So when I first got my vitamin D measured back in 2022, I was in the deficient range. Less than 30 actually was the measurement of my vitamin D. So I started taking a vitamin D supplement, 5,000 IUs per day. That successfully got me up around 40. over the next year, which is, kind of to the low end of our suboptimal range, but it's above the standard definition of vitamin D deficiency. And I decided, I guess it was October, September of last year, to bump that up to 10,000. I had one reading that moved up and then it came back down. And so I decided to increase to 15,000. And then on my next blood measurement, I was actually above 100. So I actually don't know what happened when it went up and went down, whether that was a real reading, but you can see I actually overshot. Again, the importance of measure, intervene, measure again. In this case, measure, intervene, measure, intervene, measure. Okay, you get the idea. So I've backed off on my vitamin D supplementation, actually stopped taking a supplement altogether for a few weeks. Now back to one 5,000 IU per day supplement, and we'll see where I end up. So hopefully this helps you to understand, again, why I do feel strongly that you actually do want to measure this stuff. You probably don't need to measure it as frequently as I do. And in hindsight, I probably was a little bit too quick to change my behavior based on short-term fluctuations in the measurement. So learning process all around, hopefully. So I'm getting there, but I'm not deficient anymore. I think that's one thing we could say for sure. All right. So again, our goal is to really try to get as many of our participants at least out of the deficient range and hopefully into the optimal range as we possibly can. And so with these three nutritional deficiencies in particular, I started off by saying that I was going to tell you about some low-hanging fruit today. I wouldn't even say this is low-hanging fruit. This is fruit that has fallen off the tree and is sitting on the ground rotting. There is just no reason not to fix this. So you can tell I'm a little bit fired up about this. And like I said, every time I think about this, it just pisses me off. So there's no reason as a society that we don't measure these things. It's stupid. We should, because it's trivial to fix. We don't. So you as an individual should take the initiative to make sure that you know where you're at. And if you're deficient, if you're suboptimal, get yourself into the optimal range. It's really not that difficult. Okay, so the other thing that I want to mention that falls in this low-hanging fruit category, maybe not rotting on the ground category, but pretty low-hanging fruit, is body composition. And in particular, measuring body composition by DEXA. So DEXA stands for dual X-ray absorptometry. We recently released an episode on body composition that talked a bit about DEXA and why it's the gold standard. And we'll have a couple of additional episodes on DEXA and our personal experiences with DEXA over the next few weeks. So why do I think DEXA falls in this low-hanging fruit category? So first of all, it's something that very few people get. It is completely non-invasive, a little bit of radiation. So it's about the same amount of radiation you'd get if you were in an airplane and flew from Seattle to California. So very low level of radiation. Again, unless you're doing it once a week, nothing to worry about. Even then, probably nothing to worry about. It's relatively inexpensive. So there are now a lot of companies that are providing body composition DEXAs for $50 to $100. So again, relatively inexpensive. And I think the information you get from a DEXA is extremely powerful. So you will learn about your bone density, right? Bone density is extremely important as we get older, high risk for fractures and frailty. If you are on the path to osteopenia, osteoporosis, the earlier you find out, the more opportunity you have to maintain your bone density or even start to gain bone density. There are medications that can help with that. There's lifestyle factors that can help with that. So knowledge is really power when it comes to body composition and in particular to bone density. So you learn about bone density from DEXA. You'll also learn about lean mass, total lean mass and positional lean mass. Again, maintaining muscle mass as we get older is critically important for quality of life, for ability to function as you get older. And so again, knowing where you're at can help you take steps to make sure that you're on the path towards optimal health going forward. And then finally, the thing that DEXA is probably most well known for is body fat. So with DEXA, you will get a measurement of total percent body fat, which is useful, but probably even more useful is the positional information about the type and location of the fat in your body. And in particular, what you're most interested in is visceral fat or visceral adipose tissue. So this is the fat that is underneath the abdominal wall, surrounding the organs. And what we've learned is that visceral fat is really the fat that drives inflammation and metabolic disease. So, there are people out there who are actually pretty lean in terms of total body fat, but that have high levels of visceral adipose and are at very high risk of metabolic disease and all of the negative downstream complications that come from that. The flip side of that is there are people out there who have pretty high total percent body fat, but are pretty low in visceral adipose. And so DEXA will give you that information and again, allow you to take action if necessary sooner rather than later. Again, the goal here with all of these things, with the vitamin deficiencies and with DEXA, is to find out early before you're sick, before you've got a major problem, and prevent that disease or prevent those problems, right? This is preventative medicine. It's also personalized medicine because you're going to find out about yourself. So these are very powerful tools that I hope, if you haven't utilized them to date, that you will going forward. And I would say, DEXA is something where probably everybody should get a body composition DEXA scan in your 40s. Certainly by the time you're in your 50s, probably at least once every 3 years. I would actually favor once a year going forward, just to monitor where you're at and monitor your progress into the future. So these are just a couple of the easy and relatively inexpensive things that I would say the majority of people certainly aren't getting from their primary care provider. Most people probably don't get these things at all, yet they can have an enormous impact on your health span trajectory. And so I hope that that's been useful. As always, please feel free to leave comments or post questions below. If you're not a subscriber yet, I'd encourage you to subscribe to the channel. And I hope to see you next time on the Optispan podcast.